Hi, I'm Emily. I'm a physician assistant and yoga instructor. This series of videos is designed to help put a medical spin on some of the more common yoga positions, giving yogis an insight and a better understanding of their form and the opportunity to correct it before it gets worse. So once again, my name is Emily. For today's position, we are going to be going into Warrior Two. So as a physician assistant, I do a lot of orthopedic and a lot of neurosurgery. So I'm very interested in the muscles, any spasms, the alignment of the neck, the back, all of those good things. So for Warrior Two, target muscles include deltoids, 3 deltoids, anterior, medial, posterior. Another muscle group targeted in this position is going to be the quads. Even further broken down, you have the vastus medialis, vastus lateralis, bicep femoris, gastrocnemius and soleus. You have glute medius, glute minimus, and glute medius and minimus on the left. You're also activating through the lateral aspect of that back left ankle there and lifting up through the thoracic spine to lift that rib cage up. No hunking in like this. Lifting the rib cage up. Very important in this position to remember patients and students alike to keep their hips pointing forward, all right? Everyone has a different amount of flexibility in their hips, but this is an important technique for having correct form, okay? We want to make sure this right knee is tracking directly over that right ankle, never extending beyond the level of the front big toe here, okay? We want to think of the pelvis like a cereal bowl. We don't want it to be spilling around all over, spilling our milk and cereal everywhere. We want to keep it straight to the direction it's intended, okay? Hip bones pointing towards the left side of the room for Warrior Two, extending out through those hands. Now, patients that have injuries in their knee or their hip, including patients that are just a little bit older or students that are a little bit older, the mobility in our hip joints diminishes significantly over time, particularly with that external rotation, which is what you're seeing here. This is external rotation in that front right leg, okay? Other common injuries in this area, always low back, low back, low back. Very, very common, very, very degenerative, seen in a large population group in yoga. So you want to be careful and make sure that they are tucking that pelvis under so as not to put excessive strain on that low back there. Eye gaze, as always, is over that front hand leading the way. Overall, this pose is a nice, safe standing pose. Can be accommodated with blocks, with shortening the stance. It can be as short or as wide as they need. Main thing to keep in mind, keep the knee in alignment with the ankle, never tracking over that front foot. Always informing people in your class if they have a knee injury to actually excessively back off of that front leg, okay? So even bringing it back more than 90 degrees, okay? So this would be the modification for them, all right? Once you get that good stable form, you can start to advance the pose, widening the stance. And again, everyone's going to have different limb lengths and anatomy. So listen to their body and allow them some flexibility to feel what feels good for them. All right. Again, my name is Emily. It's a pleasure doing this video for you. Feel free to like or subscribe below, and we'll see you on the next one.